Welcome to our October Ask Dr. Mozersky show, where you get a chance to go directly to Dr. Mozersky with questions on cosmetic procedures and treatments. This month we're focusing on the latest technology in facial rejuvenation, the Dermapen. Let's check in on Dr. Mozersky and Jenny and see if he has time to take a few questions. Hi, Dr. Mozersky.
Hi.
Well, I see you and Jenny are working with the instrument that we're interested in talking about today.
The magic machine.
That's right. Do you have a couple minutes? We've got some great questions from patients and other interested people this month on that machine, the Dermapen. Maybe you could show it to us for a second and then we'll ask the questions.
Yeah, okay. Well, it's a very simple little pin-sized gadget, and on this end there's 11 teeny little needles that you almost can't see with the naked eye. And this knob here determines how deep those needles go, and this one how fast the little piston on the end vibrates, and basically it just makes 11 little holes each time it cycles.
Well, I understand the term Dermapen now. It's about the size of one, isn't it?
Right.
Okay, well, let's go right to the questions. We've got a great question from patient Margaret H., who asks, Dr. Mozersky, we hear so much about PRP and vampire facials and vampire facelifts. What are these and how do they make my skin look better?
Well, PRP is a really amazing substance that we make from our patient's own blood. So we take a blood sample like the doctor does in his office, spin it down in a centrifuge, and we get the platelets out. And then we activate those platelets, and those platelets are the body's initiator of the healing process. And so they liberate an unknown number of growth factors, but there are at least 7 of them that we know of. And these growth factors produce new collagen, new cell growth, new blood vessel growth, all kinds of things that you need to stimulate cell reproduction. And the reason why it's being used in the face in this form is because slow cell reproduction is what happens to us when we get older. When we're young, this happens at a rapid rate, but as we get older, this slows down. So what we want to do to make skin look younger is to have newer cells in the skin, and this is how we do it, by stimulating them with PRP. So that's what PRP is, and the Dermapen is the latest development in terms of how to administer the PRP. It can be done with needles, it can be done many other ways, but this is the most painless and beautiful way to do it.
So thus the vampire word in there. So you're actually taking your own blood and putting it on your face with the Dermapen. Huh?
Right. We take this blood, we paint it on the face, and then we just go over the face with the Dermapen, which feels like a little cat licking your face, and not very painful at all. And then after a while, you just go home and you can go out that night and no one even knows you had a treatment.
So you can get that glowing skin for an upcoming event or the holidays pretty
Absolutely.
quickly with this, right?
That's the point. That's why we're doing this at this time of year, because we want people to glow as much as they're pumpkins. And also for the holidays, it's nice to look great too.
Perfect. I love it. Okay, well, another question comes from KT, and she wants to know, Dr. Mozersky, can you tell me the advantage of the Dermapen treatment versus laser or fractional skin type of treatments?
Right. Well, all of those treatments make little holes in the skin. And we've had a progression from using laser to using radio frequency to using the Dermapen. And the reason why we've moved in this direction is because Dermapen treatments are so much easier on our patients, and the downtime associated with these treatments is minimized. So we feel that using the Dermapen has been an amazing step forward and has really decreased the pain and suffering and downtime associated with these procedures and has produced comparable results.
Well, that makes a lot of sense in this hurried world that we're in, and also that we want to look pretty as quickly as we can. That
Absolutely.
sounds great.
And if you combine PRP with the Dermapen, then you really get a boost of activity and accelerate this process even more.
Sounds wonderful. Okay, well, our last question today comes from Amy F., who wants to know, Can the Dermapen help with other areas of my face or my body, such as acne scarring or other scarring and stretch marks?
Absolutely, and the results are dramatic. I mean, in terms of acne scarring and also stretch marks, as you mentioned, I don't know of anything that works better than this does with such a low amount of discomfort and input on the patient's part. So it's really one of the best uses of this technology.
Well, that's great. And from all indications, the timing and the cost are much better. So you've got everything wrapped up in one. Glowing skin in no time, not hurt like some of the treatments, no downtime, and getting it done by Dr. Mozersky and his team at Contour Lays. I don't see why this isn't the best thing in town right now.
I think it is. And actually, when we started doing it, no one had ever really thought about doing it in this way, and now it's like the hottest development in this area.
That's true. If people go to our blog, website, or Facebook, they're going to see a lot of articles that Dermapen uses your recommendations and your comments about just this procedure with the
Absolutely.
PRP.
If they go to contourlays.com, they'll be able to look over this in an extensive way, and it's really pretty impressive.
Great. Well, I'm sorry to interrupt you guys. Thank you, Dr. Mozersky. Jenny, thank you for hanging in there with us. And that is a great introduction to anybody that's wanted to know about Dermapen. Next month on the Ask Dr. Mozersky show, we're going to talk a lot about injectables. Most of us know those as Botox and filler. And if you get the glowing skin from the Dermapen, then you add these injectables to it, you're going to look great for those holiday pictures.